Dental pulp autotransplantation, a new modality of endodontic regenerative therapy, a follow-up of 3 clinical cases by Fitosa et al. From the Paulo Picanso School of Dentistry, Brazil. The article was published in the Journal of Endodontics in 2021. After recent breakthroughs in mesenchymal stem cell-based tissue engineering technologies, restorative dentistry and endodontics are leaning toward a regenerative strategy for the pulp and dentin complex. The induced bleeding with platelet-rich fibrin and platelet-rich plasma for open apex necrotic teeth showed a reasonable outcomes. The successful pulp regeneration in the clinical outlook is the transplant of dental pulp stem cells that are harvested from teeth requiring root canal treatment, which was diagnosed with irreversible pulpitis. These cells were expanded in vitro before transplantation to the host teeth. The seeded minced pulp mesenchymal stem cells replicated quickly and differentiated into odontogenic cells, indicating a high potential for therapeutic use. Another novel revascularization is the autotransplantation of the entire pulp. Although it has not been investigated enough, the transplantation of the entire pulp might provide the optimal scaffold for the differentiation of dental pulp stem cells in their natural environment. This case series aimed to describe the clinical procedures for dental pulp autotransplantation and to conduct a clinical follow-up for at least 9 months of 3 patients treated with this modality of regenerative endodontics. For the methodology, 3 patients were recruited for root canal treatment of a single-rooted premolar and third molar extraction. As we can see here, the panoramic radiograph of the initial visit of the 3 patients. The black circles indicate the tooth requiring root canal treatment, which is the receptor tooth, whereas the asterisks indicate the third molar planned for extraction, which is the pulp donor tooth. The first visit computed tomographic images of all teeth receiving pulp autotransplantation revealed a periapical lesion. The method for a minimum invasive pulp removal and insertion toward the receptor tooth was done at first by extraction the third molar without odontosectioning and with minimal injury to the tooth. Then the tooth was sectioned with a sterilized small diamond disc in a low-speed handpiece. Then careful removal of the pulp with a small sterilized tweezer. Then the careful insertion of the harvested pulp with the aid of a sterilized gutta-percha cone inside a previously instrumented root canal at the receptor tooth. Direct pulp capping was performed in the receptor tooth using biodentine. Then resin-modified glass ionomer cement was applied as a liner. Afterward, two-step self-etch adhesive clear fill bond was used with the selective enamel etching technique in order to offer the optimal sealing of the transplanted pulp and cavity margins. For the results, at the 3 months follow-up, all 3 patients reported a slight twinges at the periapical region of the receptor tooth, which started after 40 days and occurred during the initial 2 to 3 months after the procedure. No response to electric pulp test was detected at the 3-month follow-up. For the 6-month follow-up, the teeth received pulp autotransplantation showed a reduction in the periapical radiolucency. Moreover, the electric pulp vitality test resulted in a positive vitality response with the similar amperage to those of intact teeth from the same patient. For the 1-year follow-up, complete regression of periapical lesions was verified for patient 1 and 2, where the radiolucency in patient 3 was almost entirely diminished. Positive pulp vitality was confirmed. There was no signs of endodontic or periodontal complications. At the 1-year follow-up to confirm apical revascularization, the 3 patients underwent Doppler ultrasonic evaluation, which confirmed blood perfusion with a characteristic pulse image, thereby proving revascularization. Here are some advantages of pulp autotransplantation. First, the lack of transplant rejection. Second, there would be no laboratory intervention as the entire procedure is performed in a clinical dental office. The main limitation of this treatment protocol is patients without the presence of third molar or the presence of third molar that requires an odontosectioning. For this particular report, the main limitation was concerning the small sample size. In conclusion, pulp autotransplantation is a promising procedure when you have the conditions suitable to perform. Further studies should focus on a higher number of patients in a randomized clinical trial.